All right. Hello and welcome everyone to today's Clocked In Time Management Strategies for a Successful Practice webinar. My name is Jacob Borkover here on the webinar team at Rectangle Health. Want to thank everyone for taking time out of their days today to be with us. We've got a great presentation with Laura Nelson here for you today. Going to be some great knowledge for you. Jam-packed hour filled with lots of information that's going to help you and your practice. So before we get into things here, I'm going to go through a few quick housekeeping items. So just quick background, Rectangle Health, we work with practices in all 50 states, all across the country. We do HIPAA and OSHA compliance, reminders, patient engagement, and patient payments. So we'll be talking a little bit more about that later. And then we are PACE accredited through AGD to provide CE for this course. So this is a 1-hour, 1 CE credit course, AGD subject code 550. So I always get questions about how you get your CE. So all you have to do is be here and participate in the polling questions, and we will get you taken care for your CE. Be on the lookout within the next 2 weeks. Probably by the end of next week, you'll have an email from Nora Dowling on our webinar team, and you'll have that CE directly in your inbox from whatever email you registered from. So just be checking for that. If you are joining on mobile today and you can join us from a desktop, we do recommend for a better viewing experience and so you can get those answers to the polling questions in. And then at the end of the webinar, we're going to have a brief survey. Please fill that out. We always like to know how we're doing so we can continue to offer the best courses and subject matter for you. And then if you have any questions throughout the presentation today, feel free to drop them in the chat or Q&A. And then also you can reach us via email at webinar@rectanglehealth.com. We will have an exciting offer at the end of the presentation today. I'm going to talk a little bit more about that later. But if you do book a demo through us, we're going to give your practice lunch on us. So $100 DoorDash gift card for booking and completing a demo. So I'll be putting the link to the chat in that. And then our next webinar is next Wednesday, August 14th. It's called Make September the Best Month for Your Practice. I'm going to be throwing a registration link in the chat. So if you're interested in more free CE and another great course from us, that'll be sent your way. And then all follow-up materials, recording, everything you need will come your way via email by end of day tomorrow. So if someone from your practice wasn't able to join or you want to rewatch, you'll be able to do so. So with that, I am really excited to welcome our speaker today, Laura Nelson. Laura is an award-winning international speaker and the founder of Front Office Rocks, a virtual training platform for dental teams that teaches office systems and methods to help practices achieve exceptional customer service. Laura received the Public Speaking Award from the Speaking Consulting Network and Dentistry's Got Talent, and she's also been recognized as one of Dental Product Report's top 25 women in dentistry, and she's a great friend of ours at Rectangle Health, and we're excited to have you speak today. So with that, Laura, I'm going to send it into you.
Awesome. Well, I'm excited about the next webinar you guys are doing. I mean, I think we all kind of call September Sucktember. So it's good to plan ahead to make it the best September.
That's why we're doing it.
Exactly. Well, good. So I hope I'm leading into the next webinar because what we're going to talk about today is time management. And many times in the dental industry, we talk about the schedule, the patient schedule, and getting your patients to show up. And that's all amazing. But at the end of the day, we also need to be very efficient with our own time. And we assume that everybody is good at managing their time, but a lot of times we've never been trained in this. A lot of times we've never talked about how to manage our time. So that's really what I'm going to get into today, because I don't care if you're in New York City, Florida, Washington State, or where I am in California. The same problem we have in every dental office is that time is the rarest commodity that we have. It doesn't matter. You come in the morning, you got your list of things you're going to do. You're going to, get those things accomplished. And next thing you know, the schedule falls apart and patients run late and it's 3 o'clock. You haven't gone to the bathroom. You didn't get lunch. And you're like, where did all the time go? And there are a lot of things that we have on our to-do list and projects and things we want to accomplish and software we want to integrate and changes we want to make in our dental office, but yet the schedule runs us. And when we do find that little bit of time, there's so many things. How do we prioritize? And so that's really what I'm going to get into today, is just some basic time management skills and things that you can incorporate, your team should incorporate, you can teach your team to do. And this isn't just in the dental office, this is in life. But of course, we want to bring this into the office because taking it out of dental for a minute and just looking at business in general, there is so much time wasted in business, right? Have you ever seen the meme that says this could have been a memo? This meeting could have been a memo? Like so many times we have unproductive meetings. Employees spend an average of 31 hours per month in unproductive meetings. The average worker has 2 hours and 53 minutes that they actually are productive during an 8-hour workday. And 46% of the stress is due to the amount of workload, right? So we all have our stacks of things we all want to do. We all have our task lists, our projects. There are doctors and teams that I talk to that they're like, we've been meaning to do this for the last 3 years, but we haven't. Well, why is that? Because we're not productive in the time that we have. So that's just in regular business. In dental, it's even worse because in dental, we have the practice manager or the practice schedule run us, right? We have to fit our time into production time. So really what I'm going to talk about today, I love acronyms because it keeps me on track, is we're going to talk about focus, right? And so we're going to talk about foundations of dental office time management, organization, tasks, and priorities, choosing the right tools and techniques, understanding how to deal with interruptions and how to delegate. And then lastly, just take a deep breath, because at the end of the day, we all need to understand how to manage stress and have these strategies in place with us. Now, I'm a big fan of using AI. I'm a big fan of technology. I'm a big fan of what's the latest and greatest. Like I love Rectangle. They're looking for the latest and greatest to make our life easier. And I love to apply business topics and knowledge into dental. So where I found the statistics around business and how much time and energy and meetings that are pointless in regular business, I wanted to find stuff about dental, and there's not a lot about dental, which is we haven't researched a lot of this. We haven't put these statistics out, but I did find some things about dental. And in the dental office work time, implementing more efficient practice systems can boost your productivity by 18%. And we're all about getting more production, right? So if we actually can put in better systems, better time management, run a more efficient schedule, we're going to be more productive. And about 20% of dental offices don't even schedule the next appointment because we're so busy doing busy, which I'm going to talk about in a little bit, that we're not making sure that we're running our systems correctly. We're not making sure that our patients are scheduling, like leaving with their next appointment. So there's a true dollar result of loss of production, loss of scheduling patients by not running ourselves better, our time management, right? And so when I went out, I was looking for pictures for my PowerPoint, right? And this is the picture I found that shows dental office management. But I'm like, there's got to be better pictures out there, right? Of course, we have the stock pictures. If you look for dental offices, it's the same stock picture. But I went to AI because, like I said, I love to incorporate new technology, new things that are in the business world and bring it into dental. And if you don't know about AI yet, you can go onto AI and you can give it, you can say, I want to see Santa Claus flying on a jet over a lake in a sunny tropical environment, and it will develop a picture for you. And so I was like, okay, so the average front office team member, typically we're answering the phone, there's patients waiting for us, maybe we're holding a baby on our hip because the mom showed up and the babysitter canceled, the toilet's overflowing, so we got to plunge the toilet, the dentist is waiting. Like, this is what happens to us, right? In the dental office, we are getting bombarded by 10 different things at once, and we're trying to get our projects done. And so I went to AI and I was like, can you make me this picture? Well, let's just say AI didn't quite do very well. So I was like, I don't really know why she's holding a shower head, and I'm not sure what's wrong with the baby, but I'm like, let me try it again. Because with AI, it's still figuring itself out. So I'm like, maybe I can give it a little better prompt and I can get another picture just to kind of show what life is like in the front office. And so this is the next picture that I got from AI. I mean, I'm not sure why I think that's her tongue is a telephone or something. The baby in the back is disturbing. So I gave it one more shot. I was like, you know what? For this presentation, I really want to have a picture that shows how we feel in the front office. Kind of, maybe. I'm not sure. She's got a mouse in her hand, maybe I don't know. So I ended up giving up. There is nothing to really let the real world know how crazy it can be working in a dental office, but I get it. I'm actually the founder of Front Office Rocks, and I've been in your shoes. I started in dentistry 20 plus years ago, knew nothing about dental, jumped in the front, answering phones and scheduling patients, and learned that there's a million things going on. We have the schedule, we have the patients, we have the phones, so I've been in your shoes. And after years of doing that, I decided one of the things that I thought that we needed in our industry was training. So much like you guys are here today to learn basic skills, that's what I do at Front Office Rocks, is we teach everything from answering the phones to how to run a productive office. My background's in organizational development. I have my master's and my bachelor's in HR and my master's in organizational development. So I was in the business world and married a dentist and got pulled into dentistry 20 some years ago. No longer married to the dentist. I say I'm a recovering dental spouse, 22 years married to a dentist, but I'm still in dentistry and I love it. Because I get to work with awesome people like you guys to help implement things to make your practice better. And so that's really what I do at Front Office Rocks, is we are here to give your team the basic training on everything they need, because so many times we assume that when we tell our team members, give our patients great customer service, that they know what customer service is. Nobody's ever really trained our team members in how to give good customer service, potentially. When we say, get these projects done, and the team's like, I don't know how to tackle a big project, or I don't know how to manage my time. These are the basic trainings that we offer within Front Office Rocks, as well as things like case acceptance, scheduling, and all of the fun stuff. Because what I was looking for when I started in dentistry, when I knew nothing about dentistry, was I was just looking for people to help me figure out the best practices of how to do things. And what best practices is, if you take it, it's not a dental practice, but if you take it out of business, is you look for where other companies are doing something really well, and then you mimic it. And so what I did at Front Office Rocks, and what I love that we've built over the years with companies like Rectangle, is that we are sharing best practices. I'm sharing with you guys today my best practices around time management. And so that you can take this concept and put it into your practice, or teach your team members the basics. And that's really what Front Office Rocks is. So let's jump into the foundations of dental office management. The reason I'm bringing this up at the beginning of managing time is because when we get in the dental industry, a lot of times we have people who come from other industries, or we're new to the dental office, and we think like business people, right? We understand business concepts, but then over time we start to become more dental box thinking. When dental box thinking is where we're spending more time thinking like dental office team members, like, how much is the insurance going to pay? Do we have to pre-authorize? I presented this crown to them last time. They said no, so I'm not going to present it again. Like, we start to get in the box of talking codes and teeth numbers, and we forget about the important part of business, which is getting projects done, giving our patients great customer service, making sure they schedule their next appointments, making sure that they pay their bills. Because if they don't pay their bills, we don't get paid. We don't have a job anymore. Like, we need to realize that we are running a business here. And yes, our core competency is dentistry. But when it comes to the actual operations of the dental office, we need to be thinking like business people. Because the reason time management matters is we are losing patients out of our back door. So many offices are focused on the front door. We want more new patients. We want to market. We want people to put out reviews. We want people to talk about us so we can get more new patients in the front door. And that is 100% correct. We want patients, right? We want new patients. Some of you right now are like, no more new patients, but most of the time we want new patients. But what's happening is we're not paying attention to the backdoor problem we have. And what that means is we're spending all this money and time and energy to get our new patients in. Yet we're too busy to give them a great customer service, or we're not scheduling them for their next appointments. We're not following through on our systems, following up on patients that have outstanding treatment, reactivating patients that have fallen off the bandwagon, and we're losing patients out of the back door. And so the biggest motivation as to why we want to get good at time management is so we have time to do these things, because these things make a difference in our practice. 86% of consumers quit doing business with a company that provided bad customer service. This is a survey from American Express. So yes, there are patients, right? We think of them like patients in the dental box, but ultimately there are customers. These are people that we are having pay money to get things done. And the things done that we do are dentistry. But we need to recognize and realize that they are our customers. And if we're not giving them good customer service, at some point, they're going to go to another dental office and we're going to lose the patients that we have. 7 in 10 Americans say they're willing to spend more money with companies they believe are providing excellent customer service. So this is case acceptance. When I can manage my schedule, my patient schedule, my own schedule, my workload, so that I have time to give our patients customer service, treat them like a human when they come in the door, greet them, introduce yourself, welcome them back, spend a minute talking to them, present treatment to them, have a minute to sit down and do case presentations, and not passing our patients on the run because we're running so crazy. Patients are willing to spend more. That is case acceptance. We are trying to help our patients get their dentistry done. So I believe that there's 3 types of customer service that we can give our patients: awful, average, or amazing. My guess is if you're here at 10 o'clock Pacific, 11, 12, 1 o'clock East Coast, in the middle of a Thursday, that you're here also for the same reason. You're probably not giving your patients awful customer service. But if you're giving your patients average customer service, if your team is just average, it's not good enough anymore, right? There is enough competition out there that our patients can easily leave us and go to a dentist down the street. And not only do we have issues with losing our patients to other dentists, we actually have, they have other places they can spend their money on. They have other important things in their lives to do. So if they're going to spend time and money and energy in our practice, they want amazing customer service. So part of running good control on your schedule, personally, and your practice schedule, is so that we can have an environment people like to come into. We can have a culture that is focused on taking care of the patient, and we can run our systems so that we can keep our patients in and keep them in the schedule. Ultimately, what I believe is we need to teach our team members to treat their patients like treat our patients like family. Like, think about your mom, your sister, your aunt, wherever they would go get services, business, wherever they go shop or get their dentistry done. Whatever you would want somebody to do for your mom or your sister or your aunt, we would want to do for our patients. Now, when you think about the family, think about a family member you like, not like your cousin Vinny, but like one that you like. We ultimately want to do that for our patients, which means we need to be able to slow down and take care of our patients, which means we need to be better at managing our time so that we don't have this huge pile of work to do where this becomes the priority and we've forgotten about the patients that are sitting in the chair. So that means we need to organize our tasks and priorities. In the dental office, what happens most of the time is everything has the same amount of urgency. Everything has the same amount of importance. And that is not the case. And that is where, when we can actually teach our team members to say what is urgent, what is important, versus everything having the same amount of importance, the better we can get at managing ourselves and managing our times. Now, again, I told you in the beginning, I pulled business statistics, the numbers, because there's not a lot about dental. And here's an example of why. In the normal business, if I was a organization, this would be the organizational chart, right? There'd have a CEO, you got somebody running customer service, somebody running operations, somebody running IT. We've got a marketing department. So everybody does their thing. In dental office, it's typically all of us, right? Or maybe the office manager or one person is in charge of everything. So no wonder we're running around like chickens with our heads cut off, trying to run this small business and doing it all ourselves. I mean, we have amazing teams, but we don't have departments. We have teams and we all jump in to do the things that need to get done. So I believe, and part of the reason that I've developed Front Office Rocks was because I believe your team is only one aha away from a dream team. I believe that if we can feed into our team members, if we can teach our team members, if we can give them the buy-in and help them be part of the solution and train them and give them resources like these videos and this training, that from their own perspective, from their own lenses, you'll have a lot of, oh, I never thought of that way. Aha, I've never learned that before. Oh, I didn't even know that. Or, oh, I forgot about that. If everybody is having ahas, imagine how the team can be evolving into a high performing team, into a dream team, instead of the dentist and the office manager or the leadership team doing it, telling the team members what to do. Let's let everybody have their own aha. So that starts with why. You know, people are more motivated. We can't do the carrot and stick model anymore, where we tell you what to do and just go do it. And if you don't do it, you know, you get in trouble for it. What we need to do is we need to motivate our teams intrinsically. Like they need to find their own motivation. We want team members who are going to show up and show up. And it starts from the why, right? Why are we here? Why do we do what we do? We are lucky enough to be in an industry where our why is huge, right? Because why is not about making money. That's just the result. Like at the end of the day, production, collections, overhead numbers, that's just how you run a business. Our why is to help our patients keep their teeth for life. Hold on one second. Sorry. Our why is to help our patients live a longer and better life. Our why is to take care of our patients. Like that's huge, right? How we do it and what we do, that's just the specifics of each practice. But when we really can help our team members understand the doctor's why, the office's why, the purpose behind what we do, and then when we make decisions of the priorities of our practices and the jobs in front of us, when we have the why that serves us, that reminds us every day why we're getting up and fighting the fight, we're going to have team members who are going to be part of the solution towards making that happen in our practice, right? Now, this is not the mission or the vision statement. If you have a mission and vision statement, great. I highly recommend it. Put it on the wall. That's great for your practice. But the why comes from within. The why is the reason that we get up every day and we go do what we do, because working in dentistry is not easy, right? We have patients who come in and say they don't like us. We have dentistry that goes wrong. We have schedules that run behind. We have stress all day long. It's not like we're sitting, you know, checking people into a spa. We are working in a stressful industry. So we need to make sure that our team members are all being reminded regularly and as a team why we are here and why we're doing what we're doing. So having conversations with your team on a regular basis to talk about your purpose, to talk about your cause, your belief, the reason your office exists, and then each one of your team members leaning into their own why, and then leaning into them to teach them things like we're talking about today to be better in the position they're in, is going to help your practice improve and take care of your patients. So we want to communicate our why and continually make sure it's very clear. And your how and your what need to reflect your why, right? So whatever your practice is trying to achieve, whatever you're trying to do, how you're trying to serve your patients, the things you do, the services you offer, the systems that you use should support your why. But what happens is as our practices grow, as they get bigger, many times it gets fuzzy, right? We start to focus more on numbers and overhead and production and the schedule, and then we forget about the why. So regularly reminding our team members and talking about our why and the purpose helps us to continue to grow in the right direction. Which leads me to this. When we talk about time management, there are a lot of practices that are busy, 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 right? If I come into your practice, everyone's busy. You know, the dental assistants are over here, the hygienists are here, the front office is here, the doctors are in the office, and everyone's busy. Everyone's doing an action. And I'm like, well, what's everyone working on? Well, they're busy. Doing what? Being busy. Everyone's busy. And busy doesn't necessarily mean effective. And that is really what getting good control of your projects, the tasks that you need to get done, your priorities can turn busy into effective because we have a lot of actions that we're doing. But if I'm doing these actions and I don't understand how they serve the bigger goal, if I don't even know what the goal is, if I as an employee don't know what we're doing here, why we are here, then I don't know how this turning over the room and seating a patient on time, or cleaning the reception area up, or answering the phones by the second ring, or all the things we're telling our team members to do. If I don't understand the intention behind how that plays into the goal, I'm less motivated. I'm less intrinsically involved and interested in doing these tasks because it's just a job, it's just a duty, and there's no intention behind it. So when we can get our team members to, we all have things we have to do, but when we understand how that plays into the bigger goal, I'm going to be more effective and I'm going to be more interested in doing these tasks because I know what the ultimate goal is, which then allows us to start to pick the tools and techniques to pick the right things we should be working on, find the right ways to be doing things, having our team members be part of the decision process to be better about time management so that we can do more to take care of our patients, right? So if we get everybody in the right mindset, we all understand the why and the purpose, we feed into our team members and teach them the skills they need, whatever it is that they didn't show up with, and we continually invest in our team. Now we can look at the tools and techniques that work for the practice to help us get more time back in our day. Because the one thing we all agree on is the time is the rarest commodity that we have in our office. Time management is an overall general term, right? We need better time management. But what does that mean? For every person in your practice, it's different. Some people are really good at short, concise communication. Some people don't know how to have a short, concise conversation. Some people are better at scheduling. Other people are better at tasks. Other people are bigger at, planning projects. Other people are good at following and doing the projects. So time management is dependent on what are you trying to achieve and who's doing the tasks, right? And then making sure that the people doing the tasks have the skills to do that task or train them on it. Now, in the front office, one of the things I've always patted myself on the back and stood from the front of the room and said, I'm really good at multitasking, right? How many in here listening to this would raise their hand if I asked you who's good at multitasking? If you work in the front office, you probably should be good at multitasking. If you're a dental assistant, you probably should be good at multitasking. Like all of us have this skill, right? Which, well, should have this skill. If we work in a dental office, it can be insane. However, leaning into that as a superpower isn't necessarily the right thing when it comes to time management, because here's a good example. The word priority, it was a singular term until the 1900s. It came into the English language in the 1400s, but it was a singular term till the 1900s when we turned it from priority to priorities. The issue with that is that if it's truly a priority, then that makes it the most important. When we pluralize the word and we make it priorities, if you have a ton of priorities, nothing's a priority. And that is what happens in the dental office. We have so many priorities, so many things we're trying to accomplish, so many projects we're working on, so many tasks in front of us, that everything becomes a priority. And when everything becomes a priority, nothing's a priority. So we have to lean back into what is truly a priority. You really, honestly, at a certain time of the day or a certain project or a certain day of the week, whenever you're leaning into this, you really only can have one, maybe two priorities. not 15. Like I used to be like, I could do it all because when I do it all, I can't give anything 100% of my attention. I have to split it amongst everything. So, really focusing on what is important in this moment, hour, day, week. What is the true priority that we want to accomplish? Okay. Then it's a matter of going, okay, well, where's our time going? Like, there are things you want to accomplish, there are things you want to do that you aren't doing. Well, why is that? Because we don't have enough time. Okay, great. Well, where are we spending our time then? Because if we don't know, if we're not becoming aware of where we're spending our time, then we can't do anything about it. So if you're not getting to things, or if you're trying to get more control in your day or your week, what I recommend is doing a time study. And that's literally where you write a piece of paper on your desk or carry it around with you or put it in your phone, and you just track throughout the day, where are you spending your time? What are you spending your time on? And it's a no judgmental zone. It's not like I'm spending too much time doing this, or, I'm doing too many things at one time. Just track it so that you can look at the end of the day or the week or the month and go, I'm spending like 20% of my time on emails. I'm spending 15-30% of my time just chit chatting with other team members, or whatever the thing is. Because once we become aware of where we're spending our time, now we can look at it and say, is this our time well spent? What could I do to give myself more time? Because that's ultimately what we need, is more time. So when you do the time study, you can then, and I did this with a team member. This is an example of one of my team members, because she was spending so much time checking patients in and out. She wasn't getting to reactivation calls, recare calls, consultations. She was so busy at check in and check out. We realized that she was spending 10-15 minutes per patient checking patients in and out throughout the day. And we had 3 hygienists and 3 doctors. She never had time for anything else. And so what we needed to do is we needed to, first of all, delegate check in and check out to multiple people in the office. And then we needed to teach her how to be quicker and use technology to check patients in and out faster. And then we needed to give her her time wheel of like, where should you be spending your time? Only 20% of your time should be spent on this, while the other 20 or 30 or 40% should be spent on this. Because a lot of times we're so busy, we don't look at the big picture of like, what is it that I should be getting to? So once you determine where your time's going, next is to determine, well, where do you want your time to be spent? If something's truly a priority, you've got to put time in your schedule to give some dedication to it, or it's not going to happen. Then we look at the things that we're doing. Like I said, everything in the dental office seems to be urgent. Everything's urgent. We're all everything important. And that's not the case. There is a lot of stuff that happens throughout the day that is not important. So when you look at the things on your list, you look at high importance versus low importance, and low urgency versus high urgency. So things that are important and things that are urgent. Things that are important and things that are urgent should go into the critical activities. Critical, and if we were together, we would do a whole, like, let's break down everything we do in our day and figure out where they fit into what category. And at the end, I'm going to give you a time management tool that you can do, so you can do this for yourself in your position or with your team. But if it's high importance and high urgency, it's a critical activity. In the dental office, that is stuff that has to do with production today, patient care today, right? Like patients running late, lab cases that aren't here, patients showing up, getting our patients to pay, filling the schedule, critical activities. We have other activities that are important. They're high importance, but they're low urgency. So important goals, like if we're trying to implement a new technology, morning huddles, team meetings, inputting insurance claims, like those are important to do. They're not critical, right? Because they're not urgent, like emergency. But if we don't do them, they're going to become critical. Because if we don't enter insurance claims, if we don't follow up on lab cases, if we don't have morning huddles, then things are going to become urgent, which we don't want. So that's the important goals. Things that are urgent but not important are interruptions. So when the salesperson comes in and wants to see your doctor during the middle of production time, When the specialist comes in and wants to go back to talk to your doctor or the hygienist and they're seeing patients, that's an interruption, right? It's urgent to them, but it's not important to the practice. And then ultimately, low importance, low urgency, those are just distractions. The whole team standing around the water cooler. I don't even know if we have water coolers anymore. The whole team standing at lunch talking about something that's going to happen in the fall. The whole team standing around gossiping about a patient. Like, that's not important, and that is not urgent, and that is completely a distraction. So when we look at things happening in our office and in our positions and in our day, we need to say, well, what is important? What is urgent? And let's do that. And let's make sure we're doing the things and not everything being a distraction. Because if it's not important, it's not urgent, it's a distraction. Okay. So then we go, all right, we know where our time is spent. We know what's important and not important. We know what I should be doing versus what I'm doing. How do I get more time back in my day? And I think that you need to upgrade ADE, again, another acronym, upgrade your workflow, automate, delegate, or eliminate. So when you're looking at your day and you're like, okay, where do I spend most of my day? There's a certain percentage of your day, which are projects only you can do. That you are the person on your team to do this thing, right? So when you look at the things that only you can do, and you're like, how do I get more time back in my day on the things only I can do? It's time to kind of look at the next step of like, how can I do them better? How can I do them more efficiently? How can I do them faster? Which leads towards automate. If there are things that only you can do, but you can be doing it, especially now with technology, you could be doing them faster, you can be doing them easier, then it's time to automate. We have this problem where we just do things the way we've always done it because that's just the way we've always done it. And there's statistics out there to show like 80% of the product features in our software we're using are rarely ever or never used. Rectangle Health is a good example. They're coming out with new things all the time to make our lives easier. So we need to lean in to technology and know that these companies that we brought into our office to help us take digital x-rays, input practice, the patient paperwork, get payment from our patients, schedule, online scheduling, all these things are there to help us. And so we need to lean into the automation and let it help us. Maybe not AI making pictures for, yet, but for the rest of this, we need to lean into it, right? We need to realize that we are one of the only industries that still uses a fax machine. We can thank the insurance companies for that. But we don't, we need to step into technology. And again, that's coming out of the dental box and leaning into the business box. We need to realize that there's business out there, there's technology that can help us. And a lot of times we're like, well, this is the way our patients like it. You know what? It's not true. A lot of our patients, for me, for example, if you call me, if you're going to confirm an appointment with me or ask me to pay a bill or what, don't call me, text me. If you want me to pay a bill, send me a link, right? If you want me to schedule, send me the link to schedule. If you want to talk to me about a treatment plan, send me an email, right? Like, or have me call the office and answer the phone, right? Have somebody answer the phone. Like, there are so many technology things that we could be bringing into our dental office that the rest of the world has. And you might already work with a lot of great companies, but when was the last time you actually got on the phone with them or went to a conference like ADOM that's coming up and walked up to one of your vendors and say, show me the latest things that you guys have developed? Because these companies are developing things to make our lives easier. So we want to really lean into that and learn our software, right? Most offices are not fully using their practice management software. So get a trainer to come back in, get online and watch the videos. I have videos on Eaglesoft and Dentrix on Front Office Rocks for this reason, because we are not fully using our software, right? One of the number one videos I have is specifically on Eaglesoft and Dentrix. I don't even teach Eaglesoft and Dentrix, but I have people who do, because this is going to give you time back in your day. Okay. So Jacob, it's time. I want to make sure people are paying attention. Thinking about things you can automate. This is one of the questions, the polling questions for those listening.
All right. What is one thing you could automate? Customer service, dentistry on patients, anything in the front office that a computer, AI, or technology can do, and none of the above. All right. We'll give everyone about 10 seconds to get those answers in. Laura, I am still laughing at the AI pictures you generated.
I
Those
was
are
like, I
too
have to
funny.
share these. They're so bad. Like you can't, and it feels like that way sometimes in a dental office, right?
I like the phone in the toilet bowl personally. That
Yeah.
was that was the
We
highlight.
we could go back and just do therapy on those pictures the entire hour.
Definitely. All right, we got our answers in. 6% said customer service, 1% said dentistry, 83% said anything in the front office, and 10% said none of the above.
All right. Well, I love it. I do believe that there are things about customer service that we could automate, text messaging, appointment reminders. So that's customer service. I do believe dentistry, there are things we could automate, digital x-rays, AI, right? I personally thought the answer was like most of you, which is anything in the front office. That is a regular thing that we do. The only one I would say is none of the above. There's always, if it's none of the above, I would challenge you to go look because there is so many things available to us now with technology that we can lean into to help us automate. So thank you guys for that. So if we can't automate it and it doesn't belong on your to-do list, right? There are things that each one of us, only we should be doing. That's our job. I'm the best at it. Like for me as an office manager, my job is to be above the practice and make sure that the systems are running well. I shouldn't be entering the insurance claims or answering the phone. Now, sometimes I need to jump in and do that, but ultimately what I need to do is be the office manager. If we are getting to the point where I'm doing too many things that not only I should be doing, the next thing is to delegate. We need to be leaning into cross training and helping each other out and making sure that everybody can do things to help each other out so they don't all fall on the one person. The issue with delegating is we all feel like nobody can do it as well as I can, right? Like I'm the best at, like, for example, as an office manager, what I should be doing, what I can do, need to be doing, and only I can do is being above the practice and watching how everything's running to make sure it runs smoothly. What do I like to do? I like to do scheduling. I'm really good at scheduling. I'm the best scheduler on my team, in my opinion. But if I'm the only one who can schedule patients, I can't do what only I need to be doing, which is running the practice. So I need to make sure that I'm delegating to people on my team. So we've got to realize that delegation, though it might be something you like to do or you're the best at, if you're the only one doing it, then we can't grow. We can't. So we need to stop striving for perfection. We need to look at things in the practice that you can delegate and let other people do it. Train them to do it. If you're a doctor on this call, I'm going to tell you right now, this is 100% a doctor issue because doctors, you like to do it all. And your dental assistant can legally be doing some of the things that you are doing. So you need to look at what's legal in your state and whatever your dental assistant can be doing or your hygienist can be doing, you need to train them to do it and delegate it. So you're doing only what the doctor needs to be doing. And if you haven't been delegating, the question is, well, why? We need to train them. So find time in your schedule to do the training, cross training each other, having people walk, come up, back office people train in the front office train in the back, or get the right team members who you can delegate to, right? Because we need to be able to lean into each other and train each other so that when I'm pulling my hair out at the front desk and the dental assistant has a few minutes to come help, they can jump in and take something off my plate so that I can do what I'm best at doing. Part of the reason we don't delegate is we don't train a lot, educate and lean into our employees to get their own ahas. We tell them how to do something, and if they don't understand the intention behind it and they're not trained in doing it, they're not going to do very well at it. So then it falls back on us and they're like, move over, I'll just do it. One of the biggest things that's not taught well in the dental office or taught a lot of is the soft skills, right? We teach people how to do the hands-on things, but what about the conversations we have to have with patients? What about dealing with patients who we need to reactivate or we need to call for recall appointments or handling an upset patient or treatment plan presentations. There are so many soft skills that if we could, during some of the quieter times, the down times, have our team members training on verbal, nonverbal, skills, how to do reactivation calls, handling scared patients, answering the phones, we could then lean on each other more to delegate and help each other out, right? So recognizing that training isn't just around the actual hard skills, the actual tasks that we do, but it's also the soft skills. Okay. So next question, what could you delegate? Looking at your own position or just in general with this webinar, that would be the next polling question, Jacob.
All right. What could you delegate? Something only you can do, tasks that you can teach others to do, dentistry on patients to anyone other than the dentist, or all of the above. Give everyone a few more seconds here. All right. No one said something only you can do. 75% said tasks that you can teach others to do. Nobody said dentistry on patients to anyone other than dentists, and then the remaining 25% said all the above.
Okay, I love it. I would say the all of the above, the only one is that only things that only you can do. So when you're that's the one that I wouldn't agree with, in the sense of you shouldn't be delegating things that only you can do. So you need to be very clear when you do your time management list of the things that you should be working on. There are things that is your main skill, job requirement, responsibility, talent. Lean into that. Don't delegate that, but give yourself more time to do that so you can do that for your practice and try to delegate or automate the rest of it. And then lastly, eliminate. So when you've looked at what you spend your time on, you have automated as much as you can, like what can I use software for? What can I use technology for? When you have delegated who on my team can help me with this, who on my team is good at this, who can I train to do this? Whatever is left, if it's not important, if that doesn't serve the goal, then we need to look at eliminating it, because there's a lot of stuff that we do in the dental office that we just do it because that's the way we've always done it. Right? Like if I come to you and say, why do you do this? You're like, I don't know. That's just the way we've always done it. Well, you should understand the intention and the why behind everything you do. So if there's not a purpose to this thing you do anymore, and it's just on your daily to-do list, maybe it's time to eliminate it, right? Maybe it's time to have that discussion to say, why do we even do it this way anymore? I don't know. It doesn't make any sense. Maybe we can find a better way to do it or not even do it any longer, right? Because things that you are doing that can't be automated, can't be delegated, aren't important to be done. They're just interruptions, right? And we need to get rid of interruptions in our day. So we have distractions and interruptions that happen all day long. Remember, low importance, low urgency. That's where this falls. We need to be better at our own time management now to understand that everything that's not urgent or important is an interruption. And we need to then have self-control to get those interruptions and distractions out of our day. Now, we're always going to have some interruptions and distractions because we have patients showing up, we have the phones ringing, we have people walking in. But the more that you can teach your team members and each other to say, listen, this is my 20 minutes to sit down and make recare calls, or this is my 15 minutes to do a consultation presentation to a patient. Don't interrupt me during this because this is what is important to get done. We can now work better as a team to do the right things, because people are only going to do the right things if we hold each other accountable, right? We also want to make sure that, like I said in the beginning, we're trying to build team members who are all going in the same direction. So many times we build a culture of team members who have a lot of problems and they go to somebody on the team to get solutions. What I would rather see is have the team members start to find their own solutions. So I don't even like the word problems. I say they're issues. Don't bring me an issue without bringing me 3 solutions to that issue. And I encourage everyone to do this. When you have an issue, bring me the issue and then also tell me the 3 solutions that you think to solve that issue. And the reason that I think that is, one, because I don't want a bunch of problems dumped on my desk. Like we're all here, we're all adults, we all can help come up with a solution. Secondly, I want to see the thought process of my team member in how they are developing solutions to see, I want them to start thinking like owners. And then thirdly, it's going to take it off my plate because I can hear their three solutions and say, I like the second one, do that. Or if I don't like any of them, I can explain why those three won't work. And here's the answer to help train my team member how to handle it next time. So encouraging solutions is a big part of this. Also, if you're like me, part of time management was stop doing it yourself. Stop just whatever comes at you, just doing it right then, right? We need to get better about this is not my priority right now. This is my priority. This is a distraction. So when you're sitting down and you're starting to work on something, to ask yourself, is this something that I need to be doing right now? Right? Because we tend to just immediately respond to whatever pops up in front of us. Or if somebody asks us a question about how to do something, most of the time we like move over, I'll just do it. Right. And then you end up getting sucked into things other people should be doing that you shouldn't be spending your time on. So don't just do it yourself. Also realize that procrastination is a killer. There are things that we have in all of our jobs that we don't love doing. It's just part of the day, right? I don't like calling patients and saying they owe a balance, but it's important. And so we want to block time in our schedule to do the things that are important. Training is a good example. We have issues with that with front office rocks. We, suggest that employees do 1 hour training a week, but if we don't block it in the schedule, it doesn't happen. So block it in the schedule, pick the best time of the day for the highest chance that it's going to happen. It's the same in your personal life. Like going to the gym may be fun to you, maybe not fun to you. For me, I like it once I'm there, but to get there, I procrastinate. So I put it in my schedule first thing in the day. So I make sure that it happens. And then don't be we've always done it this way, right? I hope that I've challenged you to think now to go, all right, well, where am I going to get time back in my day? Automate, delegate, or eliminate. And don't say, well, this is just the way we've always done it, because this isn't going to last anymore, right? This is now time for us to find ways to eliminate the waste of time so we have more time. So our last question on that, Jacob.
All right. What could you eliminate? Patience. They make our days so much more hectic.
I thought that was a
Ordering
good
of
one.
ordering of supplies to do dentistry, tasks that are not important and not urgent, or all of the above.
I know we would all like to say patience, but that's not possible.
All right. No one said the first choice. We had one person say ordering of supplies. 95% said tasks that are not important and not urgent, and then 2% said all of the above.
Good job, guys. Yeah, I would say we really can't eliminate patience and we can't eliminate ordering, because if you do that long enough, you're not going to be able to do the services for our patients. So pretty much on track there. So lastly, it's just stress management and strategies. And I'm not going to go deep into this, but I am going to say that we are a team built up of people. And so personally for yourself, learning how to manage your own time, learning how to manage your own stress. And again, you're not going to find these on dental webinars. You're going to find these on TED Talks. You're going to find these on apps. You're going to find these on, how to manage breathing and stress management. But the better each one of our team members can be individually at managing their time, managing their stress, getting projects done, getting their life done, the better the team can be. So, final thoughts. The bad news is time flies. The good news is you're the pilot. You are completely in control of your time, pretty much, minus the patient schedule. I get that, but we can control, and we can even control that. I'd love to come back, Jacob, to talk about that in the future. And people often complain about lack of time, but honestly, it's not lack of time that's the real problem. It's lack of direction. And I thank everyone for being here. If you scan this QR code, most of what I've talked about today, you'll remember a small percentage of it. That's just the way life is. But if you scan this QR code, just answer a couple of questions about today's webinar from me, I'll send you the time management guide for you to post up in your office. And hopefully I'll be a reminder when you feel like you're wasting time that maybe you can delegate this thing or automate this thing. So, and on that note, I am done today, and I'll hand it over to you, Jacob. I know you've got a couple things that you want to go over.
Yeah, thanks, Laura. And in case anyone was wondering if they should trust Laura on time management, I asked her to be done at exactly 10:55 Pacific time, and it is 10:55. So she knows a thing or two about time management. Love
Thank
that.
you very much.
So before everyone hops off with that, the CE is officially over. Just want to let you know a few final housekeeping and then just a little bit more about us at Rectangle Health. So I wrote it down, Laura. You said something really interesting early in the presentation. You said companies are developing things to make your life easier, and that is exactly what we do at Rectangle Health. We're all here, especially for practice owners and office managers, to make their lives immensely easier. So we have three key solutions: bridge payments, which is all things patient payments; bridge engagement, which is patient engagement; and then bridge compliance, which covers HIPAA and OSHA compliance. Everything's in one platform. It's super easy to use and secure and reliable. We've been doing this for over 30 years, and then we integrate with basically everything, whether it's your practice management system, whatever it may be. So I have put a link to the demo in the chat there. So if you guys look on the right side and you want to learn more, you can do that. And then just to go in a little bit more details. So from an engagement side of things, we do online self-scheduling, auto reschedule, waitlist management, public review generation, patient experience surveys, forms, appointment reminders. A lot of the stuff that we talked about earlier as things that maybe you'd like to have automated, we'll automate it for you. And it'll all be super easy. It'll save your practice time and money. And then same goes from a patient payment side of things. As you guys know, chasing down people for payments can be difficult. I know my orthodontist right now is trying to chase me down. I need a new night guard, so they're trying to get the payment from me, right? And everything is simpler if you can do text to pay, automatic posting, contactless payments, increase your accounts receivable. There's so many ways that you can do it. And then lastly, with HIPAA compliance and OSHA compliance, obviously making sure your staff's trained, that they're up to date on the latest, especially when you have new hires. That's extremely important. And then protecting your practice from cyber threats. Obviously, we know we've seen a lot in the news how those are growing, so make sure that you're covered there. So if you are interested, like I mentioned, we have that link in the chat on the right side of your page there. If you fill out a demo form from that link in the chat and complete a demo by August 31st, we're going to give your practice lunch because that's another thing that'll make your life easier. You won't have to worry about lunch one day. So that'll be in the form of a $100 DoorDash gift card. All you have to do is sign up and complete that demo. And then just some upcoming events from us. We've got a webinar next Wednesday. Really great topic. I'm cracking up, Laura, that you said Sucktober or September
September.
is what you
Yep.
guys call it. That is awesome. And that's exactly why we've got a really great presentation next week, just about avoiding some of those September challenges. It's with Stephen J. Anderson. He's a really great speaker. Should be a good presentation. So sign up for that. And then also we will be at ADOM, as will Laura, September 5th through 7th. So come visit us. I've got our booth number there. We'll have all sorts of fun stuff going on there. So make sure to stop by and say hello. And I'm seeing a few comments in the chat. I know some people jumped in a little bit late. So final housekeeping. We are sending out CE credits to the email that you registered from. Those will come your way by the end of next week. So be on the lookout for that. Survey is going to pop up in the on your screen once you exit out. So make sure to fill that out so we know how we're doing here and can make sure we're providing the best content for you. And then we're going to send out all the resources in the recording. You'll get that by the end of the day tomorrow in your inbox. So with that, thank you so much, Laura. Great presentation. I'm seeing some great comments coming in here. As always, you give a great presentation, and want to thank everyone for taking time out of their days to be here with us. If there's anything we can do to help, don't hesitate to reach out. As I said, links are in the chat there. And everyone have a wonderful rest of your day. And Laura, time management, we're done 1 minute early. Look at
Look at
that.
that. You guys get to run to the restroom real quick before you get called into another meeting. Run to the restroom.
All right, everyone, take care.
Thanks, guys.